What about hyperacuity? So I know this is a wet AMD roundtable, but there's been a lot of discussion about hyperacuity devices, NoTel being one of them. Do you think in the future there's going to be a role for just having a patient come in only when they notice a change in a hyperacuity device, or do you think that's too far into the future?
I don't use hyperacuity testing.
And patients ask about it all the time, but frankly, like, how reliable is your patient even looking at an Amsler grid? And most of the patients say, oh, I look at it, once a week, and I saw a change 3 weeks ago. And they're like, well, why didn't you call me? They're like, well, I wanted to see if it got better or worse. So now you get a hyperacuity device, which might be a little more sensitive than Amsler grid, but if it's not used, it's like, you can have a Ferrari in the garage, and if you don't drive it, you're not going to get a benefit from it. So,
yeah, I don't use them. I think as technology, though, becomes more and more integrated into our practices, we're all in the shift or have already shifted to EMR. The information, we have a built-in system where patients can actually, see their charts within our EMR, certain portions of it. So it may be coming that they're going to look at their OCTs in the same way. Although I don't know that those devices are ready for prime time yet, I imagine down the road, especially in select patients, it may become part of our practices.
Interestingly, it's really the non-retina specialists that seem to bring this up more often. Many of us in the trenches dealing with wet AMD that have known diagnosis, it rarely comes up.
Sure. Yeah, it's interesting. I think maybe in the future we'll see more at least dry to wet conversions, because obviously we know from the CAT study that earlier treatment led to better visual gains, something we knew all along. But having some sort of device to get those patients into our offices may be nice.
Yes.